at the Nkosi Luthuli International Convention Center in Durban. The 2018 theme of the conference is Step Up, Let's Embrace All to End TB. The conference is scheduled to review the successes in the battle against TB in Southern Africa. TB still remains the leading cause of death in South Africa. From our Durban studios, for more details, we're joined by the conference chair and organizer, Dr. Margot Uys. She's also the head of the Integrated Health Systems Strengthening. Dr. Uys, welcome to the agenda. A very good morning to you, Dr. Uys.
Thank you very much, and good morning to everybody and to everybody listening in. As you mentioned, the 5th South African TB Conference is kicking off this afternoon with a plenary. This is a biannual event, so it's the first time this is happening, and it brings together all the people involved in TB in South Africa. So the researchers, the managers, the healthcare workers, the advocacy people, as well as the sponsorships. So we come together and share knowledge and identify those important issues that we need to concentrate on to try and finally eradicate this very age-old disease.
So
now,
we're told
this year's conference has got the theme.
Dr. Uys, we're told that in the last few years there's been massive progress in global strides to control TB. Why does it remain one of the biggest killers?
It's a very tricky disease to really get 100% control of because of various factors. First of all, because of the specific specifications of the bacterium itself, but then also it's through the ages has been associated with stigma, with poverty, and people don't present necessarily to the clinic with symptoms. They're not aware. There's a lot of awareness that's still missing. So at present we think that we're missing about 100 to 160,000 patients because they're not aware that they've got TB, that they can present to the nearest clinic. Treatment is very effective once one presents and is diagnosed. It's a long hurdle, it's 6 months of treatment, but if one sticks to that, the chances of complete healing is just about 100%. It is those cases that don't present or don't complete their treatment, those are the ones that, cause problems and then leads to multi-drug resistant TB. And that's one of the themes that we've identified this year. Apart from missing TB patients, looking at the stigma, other social and biological determinants impacting on the TB disease, marginalized populations. We also look at new drugs and new innovations, what is available. Because people don't want to stick to their treatment for 6 months. It's a very long period of time and even if one feels better, then often people just stop because they feel better. And meantime, they are not 100% cured.
Dr. Uys, another part of this conversation that is being spoken about globally is the incidence of fighting the twin disease, where a person will have TB but will also have HIV/AIDS. What are the challenges that present there?
Well, I think, research has shown that about 50 to 60% of all TB patients are also co-infected with the HIV virus. But really, our treatment for HIV has progressed so much lately that the important thing is to immediately identify those patients and really put them on treatment. There's no indication that there's any difference in the outcomes of treating a TB patient co-infected with HIV. So the important thing is, first of all, to know your HIV status and also to present to clinics if one has symptoms like coughing and loss of weight and not feeling well, anemic, being tired all the time. All those symptoms that could be quite sort of nebulous, but one should be able to, one should think of TB if one has those symptoms or the combination of symptoms and really have, go to full diagnostics. We've got very good gene expert South Africa is one of the countries with the biggest program of the new diagnostics, the gene expert, and it's available everywhere. So there's really no excuse for not diagnosing these people. I think that our biggest problem at this stage is to make people aware.
You talk about latest advancements in terms of treatment, but there's also traditionally been concerns about TB treatment. not having very good effects on the liver. What's the latest in that regard?
I think we shouldn't disregard the body is a very incredible organ, and all its different organs inside as well. And the liver is totally able to metabolize all the drugs. But one has to make certain precautions. For instance, that doesn't go well with alcohol. So, one has to sort of make those sacrifices. But otherwise, in most cases, the liver will cope. And it can't be used as an excuse. Those few cases, there will always be a few exceptions, so those need to be then treated and managed either in a hospital or in a more advanced setting. And that's the bottom line, really.
It's a very important conversation, and a large number of the population is affected. How do they become part of this conversation?
I think the important aspect is that we shouldn't not present to clinics with symptoms of TB. So everybody needs to be aware that a chronic cough for more than 1 to 3 weeks is a chronic cough. Loss of weight, not feeling well, night sweats, those things, sort of the combination of that indicates that you might have TB, and then really to go to the clinic and present to the healthcare workers so that we can investigate for TB.
Dr. Uys, tell us about some of the speakers.
Since 2008, the speakers at the conference, we've got some international speakers. Dr. Luthuli Ditius, she is the CEO of the Stop TB Partnership. We've got Dr. Jesus Getown from the World Health Organization, Professor Keerten Deda from UCT, very well-known speakers in the TB world, Professor Rob Warren, Dr. Bhavesh Khanna with new innovations in terms of cultural TB. So there's a lot of new development happening, very exciting new developments that we should discuss and that should share the knowledge and really map out the road for the next couple of years until the next TB conference. Most important thing is we need to find those 160,000 missing patients. And that is everybody's responsibility. If your friend or your family member might have the symptoms of TB, let them go to the clinic for a test.
And that's where we're going to end it. Thank you so much for your time. Dr. Margot Uys is the chair and organizer of the 5th TB conference currently underway at the Nkosi Luthuli International Convention Center in Durban. Let's take